Have you ever wondered why your anxiety medications are not providing the relief you expected? So studies show that approximately 43% of people with anxiety disorders in the United States are not receiving treatment, and those who do may still face ongoing challenges. Let's talk about 5 reasons why your anxiety medications may not be working. Hi, my name is Dr. Air. I'm a board-certified lifestyle psychiatrist. So Emma is someone who has struggled with generalized anxiety disorder for many years. She was initially not keen on taking medications, but decided to try some as anxiety was getting progressively worse. Her mental health practitioner placed her on Lexapro, also known as escitalopram. A few weeks went by and Emma was still struggling with her anxiety. This could be due to several reasons. So let's talk about 10 common reasons your anxiety medications may not be working. Number 1, not enough time. Selective serotonin reuptake inhibitors, SSRIs, are antidepressants used to treat anxiety. Lexapro, which Emma was taking, is one such medication. She had only been taking her medication for 2 weeks, but SSRIs can take 4 to 6 weeks for their effects to become noticeable. Number 2, incorrect dosage. The dose of your medication may be too low to be effective. Similarly, if you had a headache and only took half a tablet of Tylenol instead of 2 tabs, your headache may not go away. In some cases, anxiety disorders may require higher doses of the drug to work properly. However, if the dose of your medication is too high for you, this means you may have side effects that outweigh the benefits of your medication. Number 3, misdiagnosis. In some cases, what appears to be anxiety may be another mental disorder. Some other psychiatric illnesses that can present with anxiety-like symptoms are ADHD, depression, and bipolar disorder. If your diagnosis is wrong, your medication may not work, as you may require a different treatment approach. Number 4, wrong medication. The medication may not be the best fit for you, even if it works for others. Everyone is different and will respond to medications in varying ways. Switching to another medication or changing the medication class may be needed in cases like this. Number 5, not taking your medications regularly. Skipping doses or not taking the medication as prescribed can prevent it from working correctly. Medications like SSRIs should be taken daily to ensure they work properly. Number 6, genetic factors. Your genetic makeup can affect how you metabolize and respond to certain medications. Your medication may not work because it is unsuitable for your body composition. Number 7, nutritional deficiencies. Lack of essential nutrients like magnesium, vitamin D, or omega-3 fatty acids can negatively impact mental health. You may want to check out my video on the effects of magnesium deficiency on mental health. Number 8, stress. Ongoing life stressors such as work, relationships, finances, or school can overwhelm you. As a result, the benefits of your medication may not be very obvious. Number 9, medical illnesses. Underlying conditions like thyroid disorders can affect your response to medications. Your anxiety may be as a result of a medical reason, and until the root cause is addressed, you may continue to struggle with anxiety despite being on medications. Number 10, medication interactions. Other medications you're taking for different reasons can sometimes interact with your anti-anxiety drugs. This can diminish the effect or even lead to side effects. Substances like caffeine, alcohol, and illicit drugs can also interact with your medications. Now, there are a few other reasons your medications may not work, one of which is tolerance. This means that over time, your body may adjust to the dose of your medication, meaning it needs to be increased or changed. This can happen if you've been on the same medication for an extended period. Also, lifestyle factors like poor sleep, high stress levels, poor diet, or lack of exercise may counteract the benefits of your medication. Combining medication with therapy like cognitive behavioral therapy, CBT, may be more helpful. Treating anxiety can be complex and often requires a combination of therapy, medications, and lifestyle factors. Watch this next video to learn about 3 essential nutrients to help with anxiety.